aim at NHFT is to be a leading provider of outstanding compassionate care. Our mission is making a difference for you with you. We have a 5-4-3-2-1 roadmap which outlines what we stand for. It links our vision, values, behaviors, teams, enablers, and our mission of making a difference. This is why we do what we do.
The best thing about working with NHFT is I think it makes the decision-making process very simple. So everybody who works for NHFT knows that if they are making a decision in the best interest of the patient, it will be supported irrespective of other considerations. So when any clinician or non-clinician is in a spot and they're trying to make, they don't have to be confused about this. It's very simple. So I think in that way, it's a pleasure to work in that kind of thing where you know everybody from the topmost person to the junior-most person shares this culture and knows this. So, and of course, this is a very dynamic achievement. We constantly work on it. That's the best thing about working at NHFT.
Receiving the Patient Choice Award last year was the highlight of my whole career, to be honest, and it was quite humbling and at the same time quite sort of giving me that renewed determination to make a difference to people's lives. Each day you sort of come to work with an idea that you want to make difference to people's lives, and hearing that narrative, what I received was very powerful and actually renewed my determination to continue to work on improving the quality of life for people I look after. And I think it was a moral boost. I believe that showing compassion and listening and trying to sort of provide the care within the limited resources we have available and trying your best to best of your capability.
NHFT, me working here a long time means something which is very simple for me, that I enjoy coming to work. I know that the team will be there looking after the patients the same way as I do, and I can express my concerns without any hesitation. People take that on board. If it is constructive, they will make sure that it happens. Or if something I need to learn, they'll be able to let me know. And I think that was one of the biggest things which I was very fortunate to be in the trust with. Also had good leaders who supported me through my journey. And then as a geriatrician, being encouraged to become the Deputy Medical Director for mental health is quite rare. So as you can see, they have supported me through my journey. The next bit of my journey is the management element, which is being looked into, and I've been asking for the right developmental opportunities, which is being provided when I need it. NHFT's values are quite open. That means if you want to deliver the best care and you can come up with a solution, it is taken into consideration. Without us following the values of DIG-BQ or the pride values, we wouldn't be doing what we're doing now. Being an outstanding trust also is quite attractive for somebody new, which means they can actually look at what the processes are. Things have been embedded. If they think that they can change it from what they've learned in other places, we're more than welcoming to do things differently as long as it benefits the patient and also you take the staff along. We give them opportunities for learning and also giving them opportunities to be the champions for whatever change is needed.
The people in NHFT are very welcoming. They're very supportive, both personally and professionally. And there's a real passion and enjoyment for what they do. And we all tend to put the patients at the center of the care that we provide. NHFT prides itself on providing high quality care. And there's also a huge drive towards innovation, always looking for ways to make the treatment more effective and for patients and to improve patient outcomes. There's also a huge opportunity to grow your career, management roles, research roles. We also, the Trust is also a pioneer in neuromodulation, so we provide RTMS service, ECT services. So there's quite a lot for doctors and opportunities for doctors and non-doctors alike to grow their career within the Trust.
I've been here for more than 15 years. that I think itself should speak about there must be reasons why I'm here. What I find is a sense of belonging. What I find is autonomy. What I find is flexibility in the way we work. The focus remains the same. All of them would lead to the same focus of clinical outcomes. But it gives you the flexibility, the sense of belonging, and then you can achieve your personal aspirations and ambitions can go alongside the clinical work that you do. So that is what keeps me here.
The best thing which I feel, the success stories of people who recovered. That brings a fantastic joy whenever I see people recover and say, goodbye, Dr. Das, I don't want to see you again. I said, goodbye. That's really nice. This is something which I really enjoy. Seeing people recover from whether hospital admission, crisis admission, bout of serious depression, psychosis, and make a recovery. It may take weeks, months, years, but we will get there. So that brings a lot of joy whenever I see that. And the other joy which I think has happened, and I must comment about it, there have been a few service users or patients who, it's the same term, but who had serious mental illnesses. And then they got slightly better and worked within our team to co-produce documents to help other patients. Because at the end of the day, NHS is run by people like you and me. And, each one of us can have an episode any one of us can have an episode of mental illness. And so when they begin to come and work in our team, they're the best ones because they know what it is.
I think there is a really friendly and supportive consultant body in the Trust. I felt very valued. And I feel that my opinion counts whenever I raise something and that changes are made. I think it's a really forward-thinking trust. I think patient care is always at the centre and it's a can-do trust. I think that we're always looking at how to improve services and it feels a really good trust to be part of in terms of patient care.
So what I like about NHFT is the culture of NHFT, I would say. There are very strong values they hold on to, which is the DIGBQ and the pride values which NHFT has, where they put person first, respect and dignity, working with compassion. And I think that really resonates with me. And it's not only the values that they talk about, it's something they actually practice and we see in our everyday life as well. And I think I really, really love that about NHFT.